Good afternoon. Uh, Good evening somewhere in Bangladesh, and good morning in UK, of course. And I don't know where in Kampala what it is. Is it good morning?
It is good afternoon.
Good afternoon. Right. So we are, first of all, Eid greetings. We just finished our holy Ramzan, holy month of Ramzan, with prayers everywhere. And it really, this Eid had a lot of significance. So was last year, but this Eid has a lot of significance. It is also a very auspicious day for many of Hindus called Akshay Tritiya Day. So I think in this, with this auspicious day, let's have a discussion about something which is going to be much better days to come. We will certainly conquer this epidemic or pandemic, as they call it. We in India all believe in something called world is a family. It has been in our parliament written down there that the world is our family. It has been the tradition. It has come through the Vedas many thousands of years ago. And we strongly believe that the world is a family. Just as we say, Atithi Devo Bhavo, that means the guest is like God for us. So the role of the world as a family has been very well entrenched in our Indian sentiments. And whenever we have ignored that, the nature has come down in a big way and given us a jolt, not only to us, but to the whole world, and has brought us back to our senses. What happens in the remote corner of the world will certainly affect you, either today or tomorrow. Any amount of building walls or travel restrictions will not play any role in your getting affected by what is happening at the remote corner of the world. Time and again, it has shown. It has shown during the Bengal famine what happened. It has shown during the Spanish flu, and in recent years, in the SARS epidemic, the MERS epidemic, the Ebola epidemic. So the world has to take part as a cooperative movement, and the walls need to be broken down for your own self-interest. It is not a charity. It's a self-directed interest that you should participate in the development of health and education around the country, around the world. Having said this, today's speakers are very eminent knowledge source for us. We are very grateful that they are associated with us and they have readily agreed to come and participate in this webinar. Professor Elizabeth Grant, she is the director of the Global Academy of Global Health of the University of Edinburgh. And Professor Mhoira Leng, she is also with the Academy of Global Health. She specializes on very important issues of public health, and that is mental health and palliative care. Liz Grant is the force behind this global health. She has been traveling, working across the continents, and so is Professor uh, Mhoira. Both of them have worked extensively in our country. They know what it is to of the healthcare. They know very well what our rural populations are suffering from, and they are all there to help us out, and they have been helping us out through various projects. Our next speaker is, of course, she is the voice of the citizen. Miss Indrani Malkani is Ashoka Fellow. She is the chairperson of Citizens Action Group and the Citizen Action Network for the engagement with the government. And we also want her to be with us to engage with the people whom we serve. We are really fortunate to have her, and she is going to lead us in developing our patient participation group. Our next speaker is, of course, our own Captain, Dr. Kusilab Bose. He is the director of our medical operations. She has been there right from the beginning. He has extensive experience of working in the Indian Navy for the last 25 years. And he retired from there, thank God for it. He is now with us. He wears many hats. In spite of being director of medical operations, he actually consults and gets up at night, any time of the night and day, to help our doctors or the patient who requires his help. So with these words of introducing them, let me go through two slides to show what the scenario before the pandemic existed in our country. So health scene in India prior to the pandemic has hit us like a double whammy. We have 9 million patients suffering from TB. 400,000 die annually. Out of them, 65% of them have MDR, that is the drug-resistant tuberculosis. 1.5 million children below the age of 5 years die of simple dysentery and diarrhea annually. 19% of the total population and the 40% of mother and children suffer from undernutrition. 1/3 of world leprosy population is in India. Our road traffic accidents, there are 56 deaths per 10,000 vehicles. In an average, 2 people die on the roads of Mumbai every day. As compared to the USA, there are only 5 deaths per 10,000 vehicles. In UK, 2.3 deaths per 10,000 vehicles. And in Sri Lanka, there are only 11 deaths per 10,000 vehicles. We have highest number of HIV positive cases. People dying of malaria, dengue, meningitis. We have epidemics almost every year, the floods and droughts and tsunamis. We are the diabetic capital of the world. Our healthcare only caters to 10 to 15% of the upper crust of the society. They are overdiagnosed, overtreated, overcharged. Our middle class, the backbone of the country, is pauperized by expensive drugs, expenditure, expensive hospitalization, and the latest treatment modalities. 70 to 65% of the population below poverty line in rural areas and in urban slum receive only lip service in overburdened, moribund public health sector and exploited by the private practitioners. Our common man who lives in the slums, he is addicted to what he perceives as good treatment, injections, tonics, saline, cocktail of drugs, again exploited by the unscrupulous practitioners. This is the scenario of India. Thank God, through 2014, with the Prime Minister coming in, his focus changed from that to the basic health requirements of a common man. We'll come to that later. With this, I invite Liz Grant to give her presentation. Thank you.
Thank you, Prof. Sen. Thank you so much for setting this context and for making it clear that India is the microcosm of the world's great challenges. And it's not just COVID, it's COVID plus the health crisis that were there before. It's the crisis of that planetary health tries to face, the crisis of the natural disasters coming in on top of the health disasters, on top of some of the systems and logistics disasters. But what happens now in the context of COVID here in India will actually change the face of the pandemic throughout the world. And what the world does now to support India, this vast subcontinent, will change the way that humanity works together in the future. It will determine solidarity. As we think of Dr. Tedros's words as Director General of the World Health Organization, when he calls for a compassionate response, when he calls for solidarity, when he calls for countries to come together, when he says that no one's safe until everyone's safe, then what we do now really does determine where things go. I know that Mhoira is going to share the slides, and she's waiting for I think permission just to put some slides up, just a few slides where I'll talk about the information that's coming out, specifically from the Lancet and BMJ, talking about where our programs need to go, but and addressing the Lancet COVID-19 Commission for India, the India Task Force. So if we can go on to the next slide, that would be lovely. And let me know if the next slide is lovely. Thank you. And what I want to do in these couple of slides, before I hand over to Mhoira to talk very specifically about meeting needs. So I want to describe what the Commission is identifying as the recommendations and the needs that should be taken into consideration in order to be responsive to the pandemic. But these all of these needs that we'll describe, all of these recommendations are actually recommendations that every single country needs to be putting into place. So there's a huge learning that can happen. And then I'll just speak a tiny bit about the situation in Scotland, where I'm based here in the UK, and the Scottish Government's approach, and think about where there's cross nation learning from a very tiny country such as Scotland to the huge country of India, but where we can work in partnership together. So the slide here is just picking out those themes that the Lancet Commission India Task Force identified as critical for moving forward. And those themes are about medical preparedness. And that's about how do we enhance the supplies? How do we enhance home care and the triage of patients, which is essential for care? Can there be temporary dedicated facilities for COVID to prevent hospitals becoming the sites of super spreader sites? That's one recommendation, is how does that come in, not just in one state, but across all of the states? A second recommendation, which is critical for every country, is around scale up of testing. And that involves the expansion of supply of the RT-PCR tests, expanding not just to those who haven't had a test, but thinking about the responding through clinical diagnosis to those who are positive, because we recognise that testing capability throughout the world is still not sufficient to manage those who are positive with COVID. But how do we respond to those we know are positive but have not been tested yet? We must scale up testing. A third and critical issue is around the coordination of mass vaccinations. How do we prioritise vulnerable populations? And in prioritising vulnerable populations, how do we also prioritise those within the population who are potentially the most susceptible to be spreading COVID? How do we identify early? How do we ensure that we're building up the manufacturing capability and capacity for whole chain testing and vaccines and vaccinations, and to effectively manage this, as the recommendations from the Commission say, not just in-state, but cross-state, interstate connections. And that also is a call for every country around the scale-up of mass vaccinations. Some of the public health measures, the critical ones that have been identified: banning large gatherings. It's something we've been looking at in the UK, we've done in the UK, we've done in many, it's happened in many other countries. Large gatherings are sites of spread. And we know what's happened with large gatherings everywhere. But the advice, when we talk about large gatherings, the advice now is we should not be having gatherings of more than 10 people. That becomes exceptionally problematic. But it's a recommendation. It feels like we need to be moving into changing the system of how we gather together. But that means religious organisations, religious meetings need to be moved down. Social meetings need to be moved down. Large weddings and funerals being reduced to very small numbers. It's painful, it's hard to do. Closing indoor spaces to the public unless they're essential indoor spaces is another essential public health measure. And managing mobility, managing national mobility, managing international mobility. This pandemic has showed us it's a pandemic of movement, because the 21st century is about movement of knowledge, movement of money, movement of people, movement of disease. How do we manage those who are moving to keep people as safe as possible and to prevent spread from movement? The countries that have done best are the countries that have actually closed their border. Sorry, can you still hear me?
If you just unmute, we can hear you, Liz. It's just muted.
unmute. Can you hear me now?
Yeah.
So I do apologise for that. There was a problem. So we were talking about borders and how to change to ensure that the travel restriction, mandatory travel quarantine is put in place, because that has been shown to be essential for stopping disease transmission. But we know also, and this is why it's so important around our international travel community to be, and those who are deciding around community travel, to be in correspondence with each other, to be discussing, because numbers are rising in Nepal, numbers are rising in other neighbouring countries. International transmission is happening all of the time. Alongside those international strategies and those national strategies, it remains the public health measures that work. We know that are working across the globe are those essential family-orientated public health measures that are so critical. The hygiene, the mask wearing, and we're seeing still in the States and many other countries a real sort of refusal to wear masks in public, and alongside an anti-vaccination community who are being very, very negative. So how can we model as a health community, as a community of citizens, as a community of people engaged, how can we model those public health practices in the best way? Alongside that, there is political decision making, and I know we're going to talk about that a little bit later. How does the government have the best evidence to make the decisions? As universities, as health facility deliverers, the data that we have is critical to give. And having access to big data matters. Big data capability now, globally and locally, it has transformed the way that we're approaching this pandemic. It's transformed the delivery of services. It's transformed, as we all know, the extraordinary speed at which vaccinations were able to be developed. But what we need now, and this is what the Commission says, but this is what we know, we need to increase capability for genome sequencing so that it's clear when the variants are appearing, where they're appearing. We look at gender, age. We need to be understanding that in a way that we're not. And that becomes a real concern about how do corporations, how does industry, how does the health sector come on board together to look at creating a network for genome sequencing that actually will allow us to have at least 5% of all tests genome sequenced, so that we know where the variants are emerging. And alongside, I mean, we're mentioning those political decision making. We're mentioning the structure around having enough capability and capacity. We're mentioning the public health measures. We're mentioning the decisions that each of us can take around ensuring that quarantine we are responding to the quarantine obligations, and those quarantine and isolation systems are put in place and enforced, which we need. Can I check that you're still hearing me? Fine. And then finally, thinking about where our global and our local responsibilities come together, because the expansion of healthcare capability, the expanded access to vaccines, the scale up of laboratory testing and this genomic sequencing, the provision of technical assistance to train people on the ground, non-health people, to be able to triage, administer testing, to care for patients with mild COVID, to provide the palliative care support needed, to provide the support for health workers who are delivering at the cutting edge. These are all key global and local places where partnership makes the absolute difference. Could I get the next slide, Mhoira, please? And just let me know if it's come on.
It's there.
There, thank you. This slide, I'm going to say just a few more words. As I said, those issues, those recommendations from the Lancet Commission, the work that the BMJ has done, the work that many scientists across India have done, is really saying global health security is only as strong as its weakest link. No one is safe until everyone is safe. And that is the global message, and it's a local message. And it feels like it's it's not just a message for the WHO. It's not just a message that big UN agencies are saying. That has to be a message that each of us takes to heart, that recognition that each of us are part of making the world safe. Next slide, please. And thanks. Yeah. And this slide is just, I want to say that in Scotland and in the UK, the figures from India are shown daily. Every morning, the World Service, in the BBC World Service, reports on the figures from India and the shocking figures. So the world is understanding, but is the world acting for you? Are we coming together? We are told again and again what is happening, but the question also, and I think where these seminars have been so valuable, is to begin to say, what are the needs? How do we make the requests that need to be heard globally so that the logistic support, the support for each of the systems can come into place? If I can just finish with a couple of, a little snapshot of the situation in Scotland, and then we can come to think about where we move from here. So next slide, please. And in Scotland, which is a very small nation, as you all know, with just over 5 million people, one of the key things I think the Scottish nation has done that is important for us thinking about the pandemic is to understand that there are 4 key harms. The virus clearly causes direct and tragic harm to people's health. COVID-19 kills. And it just has been so, no one needs to describe to any of us here the awfulness of this infection. But there are other harms coming in alongside it that need to be responded to. As our government is noting, this virus has a much wider impact on health and social care services because the systems are collapsing everywhere. The systems of delivering care for those who have other health issues have not been helped. People have not come forward this last year. We know that across the world, there is an emerging and a burgeoning burden of non-communicable disease and other infectious diseases that haven't been captured, haven't been dealt with, haven't been managed. So this recognition is another harm, and how do we make response to that? A third harm is a harm that we're all very familiar with as well, because the restrictions, the management system, the lockdowns, the methods of trying to stave the pandemic have affected the whole way that our lives are managed. They have changed society. And while we may say that the virus has spread across everyone everywhere and there's been no boundaries, we know that those who are most poor have been most affected and impacted. This virus is a very unequal virus, and destroying and exposing inequalities. And finally, we know the virus has impacted all of the economies hugely, a damaging impact on driving up the numbers of those in poverty. And globally, the number of those in poverty has escalated. We are not on track to meet the Sustainable Development Goal 1 of alleviating poverty at all. And there's been this massive decline in where we were even from the beginning of 2020. And I wanted to highlight that, and maybe go on to the next slide, Mhoira, please. I wanted to highlight that because those 4 harms underpinning those are 6 principles within government to think about how do we respond, recognizing the interconnection between those 4 harms. And very briefly, the action to respond has been, how do we suppress the virus, complying with all of the public health measures? That has to be a critical piece. How do we care for those who need it, whether they are infected, and we have to care for those who are infected, but also caring for those who are caring for the infected, and caring for those who are not infected but are needing care for other reasons. That healthcare has to still continue. How do we support businesses and people within businesses and organisations who are affected by the crisis? How do we build forward better? It's a key part of our strategy. How do we recover to a new normal as restrictions move? And I know we, at this stage in India, the restrictions are there, but thinking in the future, how do we redesign a health service and a health system that is different, that actually does what we aspire for health to do? As Prof Gautam said at the beginning, a service that actually meets the needs of people, a service that's based on wellness, a service that's based on equity and responsiveness. And how do we protect against this? How do we avoid future pandemics? What does that mean around strengthening the solidarity that is required at present, strengthening the pandemic preparedness, strengthening genome sequencing, strengthening capability to deliver and deliver vaccines, capability to create the value chain within testing, within vaccinations, but within other protective mechanisms as well. And how do we renew our country, building this fairer, more sustainable economy and society? That's very much a part of where we're coming from. But those systems, those 6 principles, are principles that I also recognise are principles across the globe. And just finally, with the last slide, as before I hand over to Mhoira to talk very specifically about the care, the pandemic is one of fear. How do we move beyond fear? This pandemic has turned our world upside down. It's destabilized our world. It's disrupted it. It has uncreated everything that we knew. And the natural response to a pandemic is fear. And the natural response to chaos or to disorder is fear. Our questions now are, how do we contain fear among our people, stabilize order, and out of this order, how do we bring a difference? Thank you. I'll hand over to Mhoira now.
Thank you so much, Liz, and for giving us such a brilliant overview of global health thinking and understanding the context, the sort of global context for this virus. And as I just start, I really want to talk about compassion and humanity. Professor Sen, you introduced this so beautifully in the context of our societies, our faith communities, our understanding of what unites us. This is look for this short film if you want to see more. It's a very powerful short film from Antonio Gutierrez in the UN, which is really talking about we're in this together. Professor Liz has already said that many times actually it's inequalities that are driving our responses. But is there an opportunity to learn from this? I work in palliative care, as we've said, and in palliative care we often talk about how these situations of stress and challenge, which are undoubted, are also potentially opportunities for growth, because there's times when, as Liz has said, the natural order is changed. And we can quite consciously begin to be talking about, what do we want to see replace that? Is it going to be a more compassionate world where we recognize how much more we have in common with one another than how different we are? Or is it going to be, if you like, status quo, or maybe even a worse status quo? Because these issues that we see on the screen are there, aren't they? Moral distress. Moral distress, that sense that actually your own values are being impinged by what's happening. And I know that friends of mine from across the world are telling me they've felt this during the COVID-19 pandemic, the stress, the general compassion fatigue, and that feeling of being burnt out, particularly when second waves come in. The first wave, maybe people coped, but second waves, what do we do? And that also brings up existential distress, that sense of what's our meaning and purpose? What is our connectedness? That sense of being one humanity. What is our hope? And of course, you know, many of us in our healthcare environments talk to people about this. We even teach our medical students, how do we explore these things? How do we look for the strength and the resilience in our communities, in our global citizenship, in our faith communities? How do we explore that? I'm going to use a series of pictures and just suggestions. I'm not going to answer all these questions, but I hope I'm going to give us some thoughts along the way. And I'm going to use some pictures from a very beautiful book by someone called Charlie Mackesy. He's written a book that is full of diagrams, and he writes more, and he wrote it to help understand what life is really about. It's not a religious text, it's simply an artist's way of explaining this. And in all of these pictures, there's a little boy, and there's a horse, and there's a little mole, and there's a rabbit, and they're talking. So the first thing I want to say is, if you are feeling any of those things on this slide, and if those you know are feeling, the bravest thing you've ever done, asked the boy, and the horse said, ask for help. So the first thing is, let's reach out to one another. Let's care for one another at this time. This is an example of a dear friend of mine, Professor Chitra Venkateshwaran, who's spoken on this webinar before, and a Kerala-based helpline. These are there all over the country. Maybe we'll hear more from our colleagues later. But let us not feel that asking for help is in any way anything other than a sign of strength, actually, and of courage. Those of us who are running healthcare programs, let us make sure we support our best resource, and that's our staff, and offer them the kind of support they're going to need now, but as well as later. We do know that previous pandemics, such as Ebola, such as SARS, have seen quite high rates of PTSD. What can counteract against that? Some of it is giving people rest when they need it, giving them psychological support, making them feel that even if it's difficult, we're on the same side together and we're going to do this together, trying to engage the structures and the systems around that. This list on the side here comes from a toolkit that we've developed in India. You can see the link there. It's to support holistic care and palliative care in COVID-19. And there's a number of tools looking at preventing burnout, supporting people who are in distress. And this is a free to download toolkit. But let's also recognize that sometimes it's in those pains, in those scars, in those wounds, that actually we can become more compassionate to ourselves and also to one another. Teaching some of these courses that I've just mentioned there, I was really struck by how people spoke, that being able to talk about these things, being able to share together, they felt they were able to be more compassionate to themselves and to others. And again, I just mentioned this particular program. I know there are many that are running across the world, but this one we've had now more than 1,500 participants. And one thing that really touched me was a participant saying, this course has helped me have more compassion to myself and to my patients. So let's demonstrate in our teaching, our equipping people, our supporting people, even in the midst of such difficult times, to be able to show our common humanity, because one of the consequences of compassion fatigue is that we can become a bit blocking off, isn't it? But actually it's in sharing these moments together and supporting one another that we demonstrate our common humanity. Now, I've used the word compassion. It's a word we talk about quite a lot now in healthcare. Of course, it's been there in our traditions, in our communities, in our faith communities. There's this interesting equation that is being written, talking particularly about global health, that we need awareness plus empathy plus action. Compassion isn't just feeling bad about something, it's being aware of the problem. It's actually having some connection with the people who are experiencing this problem and then doing something about it. And that very proactive concept of compassion, I want to ask you just for a minute to think of what would your society, what would your healthcare context look like if this was the equation that we used when there's problem solving, when there's challenges, when there's something like a pandemic. Let me read from the Lancet, which had an article just looking at compassion in COVID-19. It said, what would the world look like? It would be grounded in the principles of justice, in the equitable distribution of resources. An approach to health rooted in compassion would help us see beyond ourselves and place the good of others first. A world rooted in compassion would embrace health as a public good. Would that not be a rallying call for us? Here's another rallying call, a young student in Gaza, and I think all our hearts go out to those in the Middle East in such conflict, and particularly the bombardment and the suffering in Gaza. And this is what a medical student told me a year or so ago, that what he saw in compassionate healthcare, in palliative care we were talking about at the time, was humanity until infinity. Isn't that an amazing concept, particularly from a place where they would have every right maybe to talk about inhumanity, but this student is choosing to focus on humanity. And again, a quote saying that perhaps the disturbance of COVID-19 may catalyse medicine to better alleviate suffering in life and death. Think about this in your context and think about what it is that you can do to make sure that this equation is being played out in your setting. Let me just give you just some snapshots. Here's snapshots. We've all seen these small acts of kindness and compassion, haven't we? From feeding people, from putting photographs on the front of PPE, and down below you can see some Palestinian colleagues making the masks look happy and friendly, particularly for children. Small acts of compassion, they make a difference. Because I think we're discovering that kindness is not just in the things we do to one another, but in the way in which we operate as organisations, as societies, as a global community. Let me just give you some snapshots from nurses. These were from a BBC interview, because it's Nurses' Day very recently, and as we know in healthcare, the nurses are always the majority of our healthcare providers. This photograph was a very profound one. In the early days of the Italian first wave of the pandemic, which you know was very severe, this picture was taken of a nurse slumped over her computer desk. And she's reflecting on that now and saying, actually, this photograph belongs to everyone that was involved. It represents all of us, and she's proud of the work she was able to put in. She thought of dropping out, but actually she's more proud than ever to be a nurse. She's gone through that exhaustion, coming to a place of really realising how much good she was doing. Here's a young man in South Africa, and a young nurse who was saying that his family didn't want him to be involved in the COVID response. And I'm sure we know this. We know the stigma that's there being applied to our doctors and our nurses, being applied to ordinary people in the streets, being applied across differences, racial and any other differences. But here's a message, isn't it? Don't give up. Do what you can and don't feel like a failure. In fact, those moments when we feel like a failure can be some of the greatest learning moments, but places also we need to find compassion and kindness. Here's an amazing nurse. She's won the Florence Nightingale Award. She works in the Andaman Islands, and she acted very quickly to clear from the ward any people from an isolated tribal community to make sure that they weren't infected. So this was a public health measure, but done with great compassion and kindness. And she followed them up to make sure things were going well. Just some examples. Here's an example of a colleague of mine from northern Uganda. When they had their first COVID-19 patient, there was a lot of stigma. People in the village not allowing the patient back. Staff saying, can we even come to work? And I'm sure this is repeated everywhere. People in the communities thinking, can I care for someone else? And I love the way she talked about how important self-care was. They're now running a psychological social support service, as many people are now, but focusing on how to care for ourselves, our colleagues and our communities. And for her, that was a real sense of God's calling. And I know, speaking to Vicky, she works in an area with a huge refugee population. She was saying to me, this is a sense I have that this is my calling, to see everyone in God's image. And that was her underlying belief and motivation. The other thing to say to all who are going through this just now is storms do end. Storms do end. We're seeing many countries who have gone through the waves of the pandemic picking up. India will do the same. India has the strength in its people to do the same. And storms will pass. And this symbol of a rainbow, I think, has been a very moving one across the world, the symbol of hope. Charlie Mackesy drew a particular guideline just for India. We're thinking of you. And I think that the sense of healthcare workers and communities the world over supporting and caring for one another is there. And so my encouragement is to think about, what does compassion really mean in our context? What would it mean to have awareness, to have empathy, and then to act? And let's build a better world as a result of this quite incredible and quite terrible, but perhaps opportunity that it brings to build a better world together. Thank you very much.
Thanks a lot. That's a great presentation, and such a great need at this time of our country, this country. But having said this, I also feel that we should look after these young doctors working in the front line, of their conveniences, of their working hours, of their salaries, of their comforts, creature comforts, of looking after their families. I think that's so important. And one of the things which in India, at least, we felt that our doctors are really going through a very stressful time because of mainly physical exhaustion. And burnout is, of course, there. The mental exhaustion is there as well. But if we had looked at their working hours, their working conditions, and their comforts of taking them back home and being rewarded for the work what they have done, instead of saying that you're doing for your profession and that's what is expected of you. That's where we failed, and we are still failing. And I would request our authorities to really look into this very seriously. And if they can't, because of the resource constraint, then the private sector should come forward, and they should participate in making sure that these doctors who are working in the front line or the front workers are properly rewarded.
And if
That's
I
one of
just,
the practical things. Yeah. Yeah, right.
and I mean, I'm so glad you
Yes,
said that, because as we've said, it has to have action, isn't it? So I think
right.
when people feel valued, when people feel that they're appreciated, then I think they can pull together. And you're absolutely right. Our healthcare workers and all those frontline, the cleaners, the people who are doing the basic jobs for us, they need to be protected for sure, and feel that they're valuable in society. Otherwise, they'll really struggle, and they may then head towards burnout, as you said.
Thanks a lot. Uh, Indrani, you are the next speaker, so go ahead.
Thank you, Professor Sen. Good afternoon from Mumbai to my fellow panelists, ladies and gentlemen. We have spoken about COVID-19 for so long now that it has really become part of our lives. We can't ignore it any longer. All persons across the globe are facing the same challenges irrespective of their socioeconomic background, race, creed, geographical location, young, old, etc. And we all need to somehow overcome this challenge, considering that such a phenomena has not really been witnessed in recent memory. Today, anxiety, uncertainty, and panic are the key issues for all persons through all levels and natures. But I believe that it will be a little different whether it's an ordinary citizen, whether it's a healthcare provider, and those citizens who are at the helm of the departments of the government. Ultimately, we are all citizens, no matter what we are doing. Crisis and trauma have somehow become our constant companion, since COVID-19, with its various mutants, arrived in our midst. The highlight, though, that has emerged is that people have become more conscious of their health and well-being like never before. And also, the citizens and patients have emerged center stage as the most crucial stakeholder. Since I am the voice of citizens on the panel, so obviously whatever I'm saying is geared more towards what we see from the other side. So I believe now it is the most opportune time to achieve our goal of an effective and caring healthcare service at the primary level first, be it public or private, as there have been many continuous learnings this past year and so many of the points that have now been articulated by the two eminent speakers before me. We are constantly using the term citizens or even patients in an all-encompassing manner. But we do need to recognize the special requirements of them. And when we look with the work on an eye with the senior citizens in general, those who need palliative care, those who are alone and their children are no longer staying with them, who are afraid of the current times and are unable to cope. Persons with disability of various degrees, including those with physical disability and faculty impaired at the same time. Young adults, children, new parents, family members who are caregivers, all of them and many more. I've just only cited a few which I have come across more frequently. So since our discussion today is related in the context of COVID, the first and foremost task is that of our collective state of mind, our mental health. Irrespective, when we talk, we readily talk about all our physical ailments, but we refuse, and when I say it's primarily in the Indian context, refuse to recognize or not acknowledge when it comes to issues related to the mind. Why? This issue affects all of us at some time or the other, and it sometimes takes over our entire lives and that of the families too. In this COVID time, this issue has become the elephant in the room, and still we won't see it. As a society, we have a very complicated relationship with mental health. I often wonder why we shroud anything to do with mental health and not get it addressed, unfortunately. I think it's about time that we destigmatized issues related to our mental health. And when I say our, it could be anybody. We are hesitant to even recognize the fact that any one of us could have an issue with our mental health, leave alone having it addressed. So what are some of the things that I, as an ordinary citizen, along with healthcare workers, of course, so suicide prevention, what are the signs to look for? We don't really know. Anxiety issues during this pandemic, adolescents and children. How does one respond to stress? Insecurities of contemporary lifestyle, and currently we don't even know what our lifestyle is. We are all wired with some coping mechanism or the other. How to leverage it? First and foremost, how do we recognize it? Are the healthcare providers, so this brings me to the question, are the healthcare providers trained with basic knowledge on all of these issues? And I mean in general context, and I don't mean the specialists. Today it is necessary to be equipped with a more all-encompassing capability to handle patients and their caregivers. It is also required to acknowledge and act upon what citizens in general, and when as a patient along with their families, want and need. Now, here we have a huge challenge. And that challenge is to fight the war against infodemic of awareness and misinformation. Good health communication is vital to robust public health. Effective communication is actually a significant factor to winning any public health challenge. To counter the countless circulation on social media, treatment protocols, prescription from doctors to their patients, as well as fake remedies, is creating enormous havoc and panic. Reality of some proportion. Equally, frequent changes by government on protocol. For example, let me take the United States. 2 weeks ago, it had said that people who are fully vaccinated should wear a mask when going to a crowded public place. Today, I am seeing the President of the United States and the Vice President both saying that if you're fully vaccinated, you don't need to wear a mask. Now, just imagine reading this in the Indian context, when so millions of us around are not vaccinated and a minuscule number is vaccinated, and we choose to move around without a mask on, what is the message that will be sent out? Responsibility of world leaders, I think, requires a little look at. In general context, information and decisions taken and reassurance and consistency is absolutely necessary, whether it's the government or the healthcare providers. And the other is to ensure seamless and unambiguous information about all processes related to COVID and its various stages of testing, home care, hospital-related, post-discharge. And here I must compliment our big jumbo facility hospital, where the dynamic young dean, Dr. Dere, who was a speaker at the first session, has started a post-COVID OPD, something which is very novel and extremely required. Free flow update. Now, when a COVID patient is in the hospital, free flow update of a patient's health status is key to ensure the family's cooperation without rancor, to allay the anxiety. All COVID patients do not kill. COVID doesn't kill all the time. In fact, most of the time, you recover and come back. But the anxiety and fear due to lack of updates and knowledge kills you. And that I mean are the ones who are away from the patient. It's a very, very tough time for all. Issues of non-COVID ailments need attention if we are to avoid other festering emergencies. In the second session, I heard the eminent doctors, the panelists, talk about, even in Oman, that non-COVID related emergency surgeries are kept at bay. And I'm fairly certain, I'm not a doctor, that complications will arise, which could have been easily avoidable. Now, systems should be in place to address such challenges. Now, let's look at community education, because that cannot be complete. Community education cannot be complete without effective means of communication by way of speech, simple knowledge, and empathy from all sides, as Professor Leng has been saying. And indeed, most senior doctors have been talking about. There is plentiful information available, but then there is a need to separate the genuine from the fake and disseminate this information for use by all, as well as to spread general awareness on one's health and well-being. Because COVID is not the only thing. If your general health is not robust, you are bound to have other issues which will take much longer time to get addressed in this COVID situation. Equally crucial is to know the skills to be self-reliant to face the challenges of COVID and non-COVID crisis and trauma in the home environment. Because every time you cannot go to the hospital, and the hospital have now somehow got the stigma, I wouldn't say stigma, perhaps very justified, of being a super spreader or a hotspot for collecting COVID. There are multitude issues that the government has to deal with in any given time, in any given point of time, or I should say normal times. And now we are in abnormal and uncertain time. And our government at this crucial time of COVID pandemic has to look beyond and get going with extraordinary governance, not general governance at all. Government interdepartmental and allied agencies coordination should be seamless, because that's a huge hurdle when it comes to many solutions being implemented on ground. India is a deeply hierarchical society, and citizens' involvement as well as behavioral change is a very complex task. There are inadequacies and strength in the Indian society. And of course, there is also the factor of rural and urban challenges with respect to healthcare. One size does not fit all. Different modules will have to be structured considering the social background, economic background, and the state culture. We have different roles to play, and our roles should complement and not act contrary to each other. Accept our responsibilities and duty to ourself first, our family next, our neighbor, our immediate community, and civil society, and in that order. I am reminded that when we board the aircraft and we are given safety instructions, we are told to put on the oxygen mask first before we help our baby. So as a mother, I say this, and it's a difficult task, but we have to train ourselves at all times to do the same. There are a couple of points I thought I would end with. The emergency situation of the current times, not only in India, but globally, should transition into positive healthcare services outcome and making responsiveness to the changed social requirement is most essential. A robust networking of healthcare services, especially in the private sector, is required to act not as competitors, but to augment each other to achieve a collective strength. The robust delivery of the public sector healthcare services in India needs a good bit of work at many levels, which is doable, but that's a subject for another day. There is an urgent need to bring about an emotional connect of the common citizen with the government, the primary change agent. This can only be achieved by working reality when there is a strong working in the spirit of partnership with a consultative approach of the three stakeholders: citizens, healthcare providers, and the government's nodal department. Policies should be implementable and sustainable, as well as have such provisions to enable to adjust to rising challenges and integrate the changes in the existing processes instead of going back to the drawing board every time a challenge comes our way. Therein comes our role, and I say this on behalf of my organization and also personally. We're bringing citizens and the government and the policymakers, who are the policymakers, together, closer together, I should say, not just together. In today's context, the government's proclamation of self-reliant India can only be achieved by closer liaison and understanding between these two prime movers. And we do need to look at our healthcare providers, not just as they wear the PPE and they look all alike, but take away the layers and understand that there is a human being beneath it and not a robot. So that's something that all of us need to look at and recognize it and act on. So I would only say sanity needs to prevail and empathy to lead our way. Thank you, Dr. Sen, for giving me this opportunity to share my thoughts.
Thanks a lot, Indrani. We can go on this subject just as the previous subjects as well, but the time is short, and I would ask Dr. Bose to give a short presentation of what Healthspring has been doing for last 10 years.
Yes, thank you everybody, and thank you Dr. Sen, because one thing I would like to put on record, being the last speaker, as they say, that it has been Dr. Sen's tremendous effort over the last month to organize the series of webinars, which have been really, really very important. And he has brought together people from across the world to speak on various aspects, both medical and non-medical. So I would like to formally place my thanks on that. Okay, while I... So, being the last speaker, and having heard the two webinars before that, I said that given that the world is increasingly looking like Alice in Wonderland, so I call my topic today through the COVID looking glass. So I would like to talk about our journey, Healthspring's journey. And I would like to talk a little bit about Healthspring, because Healthspring, while so far we have been hearing doctors speaking, they have been speaking from known silos or known spaces of healthcare. Healthspring being a little different, I thought that I'll just talk to all of you that what is going on and who are we, what has happened, and where are we with this whole COVID thing in this whole ecosystem of this pandemic. So the idea of Healthspring started about 10, 11 years ago. Dr. Sen and and Kaushik, they had this idea about creating organized primary care in India. Essentially, Healthspring has always been that. In the last 10 years, nothing has changed. And those of you who are aware of what healthcare is in India, we know that primary care is something that is not particularly robust at this point of time as we go forward. And perhaps some of the points being raised about keeping people away from hospitals could have worked if the primary care was a little stronger. So in this organized primary care, the idea of Healthspring was born, and it has always stood on these 4 pillars on which we build everything over the last 10 years. So we build on excellent clinical care, we are extremely customer focused, and we definitely talk about them as customers and not patients, because this is purely out of pocket expense, and it is not supported by the government in any which way. And we wish to be very dependable, very ethical in doing our business. Yes, we are a private limited company, but we want to be very ethical and transparent in whatever we do. So based on these 4 pillars, we sort of set out forth on our journey. And from the medical perspective, looking at medical operations, we have focused on what we call as P4 medicine, that we feel that today medicine is predictive, but we must be proactive. The individual or the client or the customer or the patient must participate in their own care, and care has to be personalized. What today also terminology is precision-based medicine. And all of this works together, they don't work separately. So based on these pillars and this concept of care, we started our journey sometime in 2011, long before this pandemic actually happened. But given this, we decided that we will provide longitudinal care through multidisciplinary care teams, because it was not really about a doctor. Yes, well-qualified doctors are very much required, but the care team and working together can achieve longitudinal care, and we can move away from fees for services to a more robust long-term care of people. I mean, we really think about care, providing care from the cradle to the grave. So in that, we have focused on appropriate care. We definitely have looked and continue to look at international care protocol, which gets customized for India. Here, I would say that Dr. Liz Grant and her team, we have been working on all of these things for quite some time now. Um, we use a cloud-based electronic medical record, which is accessible to both the doctors, patients, and being cloud-based, people can access it from anywhere. I think such a electronic medical system does not really exist in India. So that was a first for us. We are the only retail private company in India which provides 24/7 emergency medical response, which is doctor-led, where a doctor actually shows up at your doorsteps in the cities that we are present in. And elsewhere, we coordinate that care. So that is also something which is unique to us. We have our home health solutions. We have a very strong protocol-based telehealth. I'll touch upon it a little later. We also provide the whole bouquet of pathology, pharmacy, physiotherapy, nutrition, mental health. Uh, Essentially, as Kaushik says, we should provide all care under one roof. So that's what we started out doing. Uh, One of the things was that we wanted our spaces to look very non-clinical, very pleasant, and where all the services can be availed of in a cheerful environment. Uh, so all the these are the pictures of some of our clinics that will give you some idea, those who are not located in Mumbai and Pune and have not visited our clinics, that this is how we sort of put it together. But a lot of services are provided within these premises. So this was the backbone, or this was the start of our journey, so to say, and the journey continues. Right now, we are present in 2 cities, and yet we definitely are in the process. In fact, we would have had this pandemic situation not happened and the lockdown and all that. But yes, we intend to go to the tier 1, tier 2 cities across India. And with that plan, we were building, we have this what we call as our retail business or our retail presence. But at the same time, while we have been building this retail presence, interesting thing happened. Our customers, our members, clients who came to us to our retail clinics, many of them were leaders in the industry, in the manufacturing. They had their own factories, and they then came and asked us that, can you do this for our workers? Can you do this for our employees? We took the same principles of P4 medicine. We took the same principles of clinical care and customer focused and dependability, ethical care. And we then took this care on site. So we took the care to people who wanted it, where they were, not asking them to come to our clinic. And where we were looking at workers, we were looking, and this was in very remote locations, oftentimes even offshore, out at sea, where we are looking after the workforce, where we look after their health assessment, how healthy they are, because as Indrani mentioned, that unless a person remains healthy, the other health issues will come up. We provide them emergency support. Um, we are doing their health evaluations as per government mandate and otherwise also. And then based on all of this, we are creating a calendar, so to say, where we engage with employees individually as well as in groups to look at various aspects of health issues that they might need, including mental health. So this is also something that HealthSpring has grown into, and this has grown very big. This is where we are in terms of occupational health today. In fact, you can see those red triangles. Those are 200 miles off Mumbai. In fact, today morning, we have evacuated a patient who has had a bad fracture from one of these oil rigs. So this is where we are. This is what we are doing. And this is the whole bunch of companies that we have been working with. So what happened was that these companies and this workforce, they were with us. Some of these companies have been with us for 6 years. But when last year, when the pandemic happened, many of these companies who they actually their employees always had this ability to call our 24/7 help call center, but it would be very sporadic. People didn't need it. If they were in an emergency, they would call. But as COVID picked up and people realized that they can't step out of their houses, the digital health, the telehealth really became lifeline. Both not just to look after them and see that they're doing well, but even in that isolation, the home isolation, where we manage home isolation for quite a few companies, the just the fact that they're able to talk to a doctor is huge in that when they're in that lonely space. And also for them, not just we don't just talk, we also help them with the pan India testing, both for rapid RT-PCR and rapid antigen test. We help with oxygen support, including oxygen concentrators. Some of these companies, we have helped them source oxygen concentrators for their employees from US, UK, and they have been brought here by chartered flight, and then we are issuing it to these their employees whenever there is a clinical need for that. We coordinate ambulances, hospitalization. Yeah, hospitalization, this second wave in certain parts of this country has been a real nightmare. But I'm very proud that the team has done wonderfully well in trying to help people out in this. Uh, the other thing that we did, that we have set up end-to-end COVID care centers, because many of these factories or even mines, like they are really, really remote. And in India, in those remote rural locations, there is not much of healthcare available. So we have set up for companies, beds, a total of, I think, 500 beds are running now in these locations where we have set up the infrastructure. We have created mobile facilities, and we have put doctors, paramedics, the entire staff, and we are supervising it on a daily basis. So that is something else that has happened in this COVID, which has made us much more nimble as we have moved on. So some of the numbers, just to tell you, in since the lockdown happened, I was looking at my electronic medical record data yesterday, and we have had 50,000 patient encounters around. Despite the fact that this country was mostly locked down for the most period, but the encounters also now then moved on to the digital space. We have rapidly scaled up our telehealth ability because uh, people started using that facility. So right now, 10 companies, employees and their families, as well as our own retail members, have access to this single number which operates 24/7. Total people who have access to this is 70,000. So they have that number. It has been made into their I number in the phone. So they have it. I was looking at the data, what I saw last year in the total 1 year, there were over 3,600 calls which we received from these employees or their families. But in 2021, that is from January to now, April, we have received 2,600 of them. That itself gives you an idea of how dangerous and how devastating the second wave has been. The one whole year, 1,000 calls, 3 months, 1,600 calls. We are ongoing running home isolation program for about 1,000 people. That is a like a merry-go-round carousel, because every 14 days, whoever has finished their quarantine, they move out, and people are moving in, moving out. So that's the capacity we are having. In the COVID care centers, we have managed more than 1,500 patients in those beds that I talked about. We have provided ambulances to more than 1,000 people, and hospital admission. And this hospital admission actually we needed only in these last 3-4 months, when all hospitals were running out of oxygen, and we had to really coordinate where was the ventilator, where was the oxygen. So that remained a big challenge for the last 3 months. So In short, I would say that, yeah, 10 years back, we set out to establish a robust primary care. We started with many firsts. This was an organized, protocol driven care, managed care. We had this 24/7 emergency medical response, doctor led. We had this electronic medical record. Then we have all these companies that we are working with where occupational health was not understood. We have taken their occupational health to something that is, that means is meaningful. And in fact, we have now developed scorecard-based wellness programs. So the worker gets a simple scorecard which tells him how good he is doing in his health and wellness. With all that in place, the pandemic still pushed us and our teams to the limits, and very proud of how the team has done in the 1 year. But yes, our teleconsult and our training program on distance communication, including audio, video communication, that has had to be augmented very quickly, suddenly. But in all this battling in the trenches, we have become more nimble, and I think we have become much more sustainable as an organization. And one good part, if I can say it's a good part of COVID, that previously we had to run after people for them to stay healthy. Now, people are running after us to save them from the virus. So people are actively seeking healthcare. So if that remains, and what Indrani was talking about, that if the community, the people, and the healthcare, they can work together, and people seek to improve their health, not just on COVID, but on non-COVID as well, I think that would be a great achievement that would come through from this troubled times. And as my Master Chief Bosun mate used to say, tough times don't last, tough people do. Thank you for a patient hearing.
Thanks a lot. Thanks a lot, Dr. Bose. And you have shown what tough people are, how they react to this. And we are so grateful that you are with us. It's a loss to the Navy, but thank God for that you have joined us. So with this, I think we come to the end of the session. And I would like to thank all the participants right from day one, Professor Sundaraman, Professor Sita Naik, Professor Dere, and then later on, those who were actually working in the hospitals, Professor Ajoy Sarkar, then Dr. N.K. Pandey, Professor Prateet Samdani, and my good friend and student and colleague from Oman, Dr. Bhattacharya. So all this really gives you some idea of what we are facing today. And the whole idea was to give you some broader vision of this pandemic, how it has affected all of us all over the world, and how locally we are trying to tackle this. I'm sure we will be able to do that. We will conquer this pandemic as we have conquered all other pandemics in the past. It's a combined effort. Everyone is in it together, and we will be, at the end, we will win this battle. With this, I had some slides, but then I think it's rather, you have said it all. We do have some message for the government. They are doing a wonderful job. This is a great opportunity for all of us to join hands with the proactive government, which decided right from day one to go in and look for basic health requirement starting from our Prime Minister, who said at the very beginning that he would like to build a toilet. He sent a message. The message is go to the basic healthcare requirement of a common man. And all his various various things which he had mentioned and he has backed it out, they all are directed towards the basic health issues. So we in the medical profession, we in the community at large, we should all get up and make sure that his vision is being carried out. With these words, I would end today's session, and we would like to have similar such sessions later on uh, till we at it until we conquer this pandemic. Thank you. Thank you all again.
Thank you, everybody. A pleasure.
Dr.
And there is
Sen,
a announcement by Soumya that we are recording this sessions. We will also publish this as a workshop to be, and it would be available to all concerned. So it's a continuity of work. And thank you, Soumya, again. And anyone wants to suggest some few words, would you please, starting from Liz, could you say the last few words on this session?
Dr. Sen
Point,
also,
just a moment, Liz. Dr. Sen, Debashish has raised his hand. He would like to say something.
he wants to
Right,
say something.
go ahead. Devashish, where are you?
There he is.
Oh, there he is. Good.
Yes. Yeah. I've been following all your sessions, my dear teacher and mentor and guide. I just want, since these are going to be recorded and published, uh, Mrs. Indrani Malkani made a statement which I would love to clarify and rather correct. Uh, I am very categoric and I'm clear when I said in Oman, most of the hospitals have been converted into COVID hospitals, but we have only suspended elective surgical work. Emergency work is something which is going on simultaneously along with acute and intensive COVID care. So she made a generic statement that even in Oman, the emergency, non COVID related emergencies have been put on hold. No, they are very much getting attended to, catered to, and treated as well. It's only the elective cases, particularly like the non-malignancy and the other kind of situations where the surgery or the procedure or intervention can be delayed. So that was the only clarification, because I wouldn't like a wrong notion to be published and circulated in the international media. So in Oman, we are very much catering to non-COVID emergencies. Thank you so much. And it was lovely being a part of this elite platform and wonderful endeavor of my dear Professor Gautam. Thank you, sir. Thank you very much.
Thanks a lot, Devashish. That's what I wanted to say. There's so much to learn from a small country like Oman. And we will take these, the one which you gave the presentation about how your country reacted to this. Hats off to you. And we will take up these positive uh, statements, what you made, and how Oman is facing this pandemic. And I had, in fact, requested you to give this presentation to our Indian ambassador
Yes.
so that it goes to our authorities over here.
I have
Thank
already
you.
initiated. I have already initiated.
Thank you. Thank you
Thank you,
again.
sir. Thank you, sir. Thank you.
And thank you all the participants for listening to us patiently. Uh, uh, I don't know whether we were able to uh, uh, give answers to your queries, and I'm sure there are plenty of queries. Do send your queries and we will try to answer it to you directly. Thank you again, and we look forward to many such seminars, webinars again. Thank you.
Mrs.